Have you ever wished that difficult experiences or past hurts could simply fade away on their own, allowing you to move forward without a trace? It is a natural human desire to seek relief from pain and distress, especially when it stems from deeply impactful events. The direct answer is no. Post-traumatic stress disorder, or PTSD, typically does not just disappear without treatment. While some individuals might experience a natural reduction in symptoms over time, PTSD is a complex condition that usually requires active intervention to resolve. The core reason PTSD persists is due to the way trauma impacts the brain's processing of memories and emotions. When a traumatic event occurs, the brain's fear response system, particularly the amygdala, can become overactive while areas responsible for memory and context, like the hippocampus and prefrontal cortex, may struggle to integrate the experience properly. This can lead to the feeling that the past event is still happening in the present, triggering intense reactions, nightmares, and avoidance behaviors. Without treatment, these neural pathways often remain entrenched, making it difficult for the brain to naturally recalibrate. For individuals navigating PTSD, understanding this mechanism is the first step toward effective healing. You can begin by recognizing that your symptoms are not a sign of weakness, but rather a normal, albeit distressing, response to an abnormal event. Seeking professional guidance is key, and this often involves exploring therapeutic approaches that help your brain reprocess the trauma. For example, therapies like cognitive processing therapy or eye movement desensitization and reprocessing, known as EMDR, are designed specifically to target these disrupted brain processes and help integrate the traumatic memories into your broader life story. One insightful aspect of PTSD treatment is learning about your personal triggers. These are specific cues that can inadvertently remind your brain of the trauma, even if they seem unrelated. Understanding and gently approaching these triggers, perhaps through exposure therapy techniques guided by a professional, allows your brain to learn that these cues are no longer dangerous in the present moment. This process, known as habituation, is a powerful tool in reclaiming your sense of safety and control, shifting the brain's automatic fear response to a more measured reaction. Ultimately, recognizing that PTSD is not a condition that simply fades away empowers you to take proactive steps towards healing. By engaging with evidence-based treatments and understanding the brain's role in maintaining symptoms, you can actively work to reprocess traumatic memories, manage triggers, and build a more peaceful and fulfilling life. It is about actively helping your brain learn new ways to respond, moving from a place of chronic alert to one of calm and resilience.